Let's talk about some medical news this morning. Doctors have confirmed a human case of rabies contracted in Northern Ontario, contracted from an infected bat. And it is the first case of a human case since 1967. So it's rare in humans, not so rare in animals, but rare in humans and concerning because of what happens when rabies infects a human and what can happen if it's left untreated. Dr. Isaac Bogoch is here to talk to us in more detail about this, an infectious diseases specialist at Toronto General Hospital. We're back to normal, back in the studio, and it's good to talk to you about something that is not normal. I know we know rabies is bad, but what is rabies, first of all?
Yeah, so rabies is a devastating viral infection. It's still a major global health issue. So it kills about 60,000 people per year on the planet. The vast majority of these cases are in Africa and Asian settings. But of course, sadly, we still have it in Canada. It's extremely rare in Canada. Since it started to be tracked in the 20s, there's been fewer than 30 cases.
Yeah, 1924 and 26 cases. Yeah. So it's rare, but it happens, and there is a human case right now. How is it transmitted from infected mammals to humans?
So it's through the saliva. So you either get a bite or a scratch that's contaminated with the saliva that's infected. It gets into our peripheral nerves, and it can travel through the peripheral nerves proximally, closer and closer it ascends. It gets to the brain, and then it causes fatal encephalitis. So inflammation of the brain leading to death. This is the infection that has the highest case fatality rate on the planet. It's about 100% fatal. It's a devastating and terrible infection.
How long does it take? Because when we're talking about rabies, timing is critical. It is so important to get that medical treatment quickly. So when you get a bite or a scratch, how long does it take to progress in the nerves to the point in the brain where it's really serious?
Yeah, that's a really interesting question because it depends. It can take anywhere from days to weeks to even months, and there's even case reports of years, but typically it's measured in days to weeks. The farther away from the brain the bite is, the longer it takes for the virus to track through the peripheral nerves to get up to the brain. So a bite, for example, at the tip of the finger will progress to rabies slower than, for example, a bite or an exposure on the face. Regardless, as you point out, the most important thing to take home from all this is if there's any potential exposure, just a potential exposure, it's extremely important to seek care right away because there's very effective post-exposure prophylaxis that can prevent the onset of clinical rabies, which we know is about 100% fatal.
Two things based on that. Number one, you say presume. There are cases where, you wake up in a cottage or something like that and there's a bat in the room, and I think the medical advice is to assume there's been some exposure because they're so tiny often, those bites or scratches, there could be rabies exposure. So if there is a known case or a potential, what is the treatment? What do you do?
So just related to that point, not all bats in room are going to be exposures, but if you're concerned, you've got to seek health care. Like an infant or a baby will never be able to vocalize if that bat was on them or not, and you just have to be careful. So I agree with you completely. If there's any question, just get health care, just talk to a health care provider, and they'll sort this out and work with you to sort this out. The post-exposure prophylaxis is available in Canada, and it's very effective. It composes it's comprised of two items. Number one, a rabies vaccine, and number two, a product called rabies immune globulin. And with those two products administered in a timely manner, they're extremely effective in preventing clinical rabies. But the key issue is, A, acknowledging that there's an exposure or a potential exposure. It's not fair to ask people to know exactly what happened, but the key is acknowledging that there may have been an exposure. And number two, seeking health care right away. The healthcare provider will help determine if indeed this was an exposure or not, and if it was an exposure, getting access to these prophylactic medications. But recognize there may have been an exposure, seek immediate health care, and quite frankly, all will be well because these prophylaxis regimens are very effective.
Immediate, timely, critical. We keep reinforcing that. It's interesting, though, in the case in Ontario, they've actually begun to look for close contacts and to offer post-exposure prophylaxis to those close contacts. Now, as I understand it, there's never been a human-to-human transmission, but is that theoretically possible?
Yeah, it is. And there hasn't been a human-to-human transmission because we know that this is transmissible through the saliva.
Right.
So if someone has clinical rabies, you have to take precautions around that infected individual that you're caring for to ensure that people who are in close contact, be it the family members or healthcare providers, that they're not exposed inadvertently to that person's secretions and saliva that is infectious. It's infectious. Now, North America, actually globally, as you point out, the human-to-human transmission is next to nothing. In North America, most of the exposures are from bats. There's other animals in North America that get rabies and transmit rabies. In Canada, it's raccoons, skunks, foxes. In other parts of the world, it's dogs. We don't see rabies in dogs with any degree of frequency in North America. We have vaccines for our dogs routinely here. But the take-home point is exposure to bats or wild animals or an unprovoked attack by a dog, you got to think rabies. And there's other infections as well that they can transmit. Get timely care, get prophylaxis, prevent this infection, and we'll be okay.
Okay. Dr. Bogoch, I'll see you next week, and thanks for coming in on this today.
My pleasure.